Hello everyone. Today's video will be focusing on coordination test, an essential part of neurological assessment in physiotherapy. Yeah, the importance of coordination test is nothing but coordination is vital for functional movement. So, impaired coordination affects balance, gait, and daily activities. So, testing helps to identify the neurological deficits of the patient and to localize the cerebellar or sensory involvement of the patient. So, in which we'll be able to understand the problem which is where it is present, so that we can a framework we can frame a guide for the rehabilitation planning of the patient is also being done with the help of it. So standing and walking coordination tests, so there are multiple tests. So standing tests like Romberg and single leg stances assess static balance, so in which Romberg's test will be doing nothing but the patient will be standing in a place, and we'll be making the patient to close their eyes, to stand their feet together. So if the patient is able to stand as it is, so then the patient is fine. If he is not able to do it, so it is considered as a coordination imbalance or a coordination issue over there. So whereas this is done for static balance. As we all know, static balance is nothing but a balance which is being gained during a static position like sitting or standing, something like that. Whereas in dynamic balance, it is nothing but the balance is happening during walking or doing some activities. It is nothing but moving. Yeah, not a static one. That is said to be as a dynamic one. So walking tests such as tandem gait. Tandem gait is nothing but the patient will be asked to stand with their one foot over front of the other foot. It's nothing but so tandem gait. So evaluate dynamic balance. So observe for so in which we'll be observing if there is any sway is present. Sway is nothing but the patient will be moving to and fro or side to side. And is there any ataxia? Ataxia in the sense in coordination of movements that is happening together. And any compensatory strategies. Compensatory strategies is nothing but the actual muscles will be doing something else, whereas the accessory muscles or compensatory muscles will be working instead of the actual muscles. So all those things will be assessed during the test. Yeah, upper limb coordination test is also being done, whereas yeah, finger to nose test, in which the patient will be asked to touch their nose with the help of their finger, either index finger or pointing out any finger, but usually it is just one finger pointing to the tip of the nose. If the patient is able to touch it, the patient is fine. If they are not, then they'll be concluded as if there is any coordination issue, something like that. And the second thing is nothing but a finger to therapist finger, so in which the therapist finger will be placing over one direction, the other direction will be given to the patient's hand. So the patient has to touch the tip of the therapist finger. If he is able to do so, then he is fine. If he is not, there is an issue in the coordination. Whereas the other thing is finger opposition test is also been done. So in this we'll be looking for any dysmetria in the sense that usually the patient will usually a person will be able to assess the distance to touch one object. So if it is not present, it is said to be as dysmetria. Whereas other things like intention tremor and poor accuracy is also being tested in such patients. Yeah, this is what I've been talking about, the finger to finger alternate nose to finger and finger opposition tests in a detailed manner. Yeah, the other tests like rapid alternating movements and lower limb test is also being done. It is nothing but supination and pronation. Rapidly we'll be asking the patient to palm up and down activities like that. So the speed and rhythm is also noted in such tests. And in coordination here significantly affects the gait and independence. Yeah, and interpretation and is also be done according to it. Yeah, here comes the coordination. So interpretation, so understanding findings like ataxia, dysdiadochokinesia is nothing but, as we talked before, if the person is unable to do the supination pronation test or the test we have been discussed before, it is said to be as dysdiadochokinesia, and dysmetria is essential for diagnosis. So coordination tests are indispensable in neurological physiotherapy, so as we all know. And thank you for watching.